Sure. Simon Rule, I'm a haematologist from Plymouth in the UK. Yeah, there were a few highlights for mantle cell lymphoma this year. I think perhaps the most practice-changing is the study of Steve Leguil using rituximab maintenance post-autologous transplantation in young patients with the disease. And we've seen that study for a while now, showing a progression-free survival benefit in favour of the rituximab maintenance, but at this meeting we saw that translated into an overall survival benefit. So I think as far as practice-changing right now, that has to be it. I mean, I'm already actually doing that with my patients. But yes, giving rituximab maintenance following a high-dose procedure, probably any high-dose procedure frontline for a young patient would be appropriate. Steve's study was 3 years of rituximab maintenance. I think most of us would be using 2 years just because of the funding constraints, and probably 2 is as good as 3, but a reasonable period of maintenance after autograft is appropriate. Perhaps the thing that excites me the most, because it reflects on a trial I'm doing, is Michael Wang's data on ibrutinib rituximab frontline in young patients. So Michael's giving the patients that combination, and he keeps it going until he gets to a complete remission, and then he's giving them hyper-CVAD, and then stopping therapy. Now, the concept of chemo-free is obviously very topical. So that's a chemo-free start with a chemotherapy finish, if you like. But he's giving less chemotherapy than he would ordinarily give. That's the justification for the study, and he's stopping treatment. We have a trial that's just started in the UK using ibrutinib rituximab in older patients, and that's randomized against chemotherapy and rituximab. So we would think that will be the trial that will tell us whether that's the thing to do or not. It's early. It's going to be open in just about every centre in the UK and the Nordic group, and possibly other countries as well. So for me to see that when he used that, 100% of people got a response for frontline mantle cell lymphoma was really quite extraordinary. So that potentially is a very exciting thing. You add other drugs in, you get toxicity, of course. Probably a bit too early to say too much about what that's actually going to mean. They're all smallish trials. But I think that just gives a flavour that combinations are coming, and we got the first look at that at this meeting. And over the next couple of years, there's going to be an explosion in those kind of studies.